A recent study found that a high concentration of lithium in drinking water may increase the likelihood of giving birth to a child with autism spectrum disorder, ASD. The research was published in JAMA Pediatrics and was conducted by teams from the United States, Denmark, and the United Kingdom, as reported by CNN on April 3, local time. Autism spectrum disorder, ASD, is characterized by problems in social interaction, communication, and behavior. According to the U.S. Centers for Disease Control and Prevention, 1 in every 36 American children has ASD. April is Autism Awareness Month. Lithium is an alkali metal found naturally in some foods and groundwater. It is used in batteries, lubricants, air conditioning, as well as for the treatment of bipolar disorder and some blood disorders. The concentration of lithium in U.S. drinking water is not regulated by the United States Geological Survey, USGS. The researchers analyzed the lithium concentration in 151 public water supplies in Denmark, which were estimated to have similar levels to those found in U.S. tap water. They then used the Danish Civil Registration System's address information to determine which water supplies pregnant women's homes were connected to. The researchers found that as lithium levels increased, so did the risk of ASD. According to the study, children born to mothers residing in areas with the highest lithium concentrations in water were 46% more likely to be diagnosed with ASD than those born in areas with the lowest concentrations. The researchers noted that these findings remained consistent even after controlling for other factors known to influence the risk of autism, such as maternal age and smoking during pregnancy. The study found that lithium levels increased the risk for all types of ASD. Beate Ritz, professor of neurology at the University of California, Los Angeles, UCLA, Geffen School of Medicine and the study's lead researcher, said that lithium disrupts neural development during pregnancy and infancy. She explained that animal studies have shown that lithium affects the WNT signaling pathway, which involves the WNT protein acting as a receptor and plays a critical role in brain development and autism spectrum disorder. Based on these findings, Ritz recommended that pregnant women use filtered water and have the lithium concentration in their water tested. She emphasized that bottled water, which also comes from general water sources, is not a viable alternative. Ritz added that the lithium levels in Danish tap water are likely to be low to moderate. According to a 2021 study by the USGS, approximately 45% of public wells and 37% of U.S. household supply wells were found to have potentially health-hazardous lithium concentrations. Lithium is also used as a treatment for depression and bipolar disorder. There has been debate about whether pregnant women can safely take lithium, as it may increase the risk of miscarriage or congenital defects. Other studies have also found links between lithium in drinking water and the onset of adult neuropsychiatric disorders. David Bellinger, a professor of neurology and psychology at Harvard Medical School who reviewed the paper, said, "If all these associations are valid, we need to pool our wisdom to develop guidelines for lithium levels in drinking water." However, Max Wisnitzer, director of the Rainbow Autism Center, cautioned that it's an interesting association, but causality has not been firmly established. He pointed out that research involving pregnant women taking lithium for mental health disorders did not show an association with autism, despite these women being exposed to much higher levels of lithium than those found in tap water.